What if I told you that some of the most routine medical tests recommended after the age of 70 might actually increase your risk of harm, not health? Sounds shocking, right? But here's the truth. As we age, our physiology changes. Hormones decline. Metabolism slows. Our immune system adapts. Yet the healthcare system often uses the same screening playbook for a 75-year-old that it uses for someone who's 45. That mismatch can backfire, leading to stress, unnecessary medications, and procedures that do more harm than good. Now, don't get me wrong. Testing can save lives, but only when used wisely. In this video, we're going to expose 5 of the most common overused checkups after 70 and reveal what to do instead using smarter, safer, and more personalized strategies grounded in functional medicine and metabolic health. Let's get started with one of the most misunderstood checkups of all. Part 1. Colonoscopy after 70, when the cure becomes the risk. Colonoscopies are often considered the gold standard for colon cancer screening. But here's what you're not told. Once you're over 70, the risks of this invasive test may outweigh the benefits. Let's break it down. A colonoscopy involves inserting a scope into the colon to look for polyps or cancer. While it's effective in detecting problems, it's not risk-free. After 70, complications become more common. Bowel perforation. The scope can accidentally tear the intestinal wall, a potentially life-threatening emergency. Bleeding, especially if polyps are removed. Adverse reactions to anesthesia. Older adults are more sensitive to sedatives, leading to delirium or a longer recovery. Hospital-acquired infections, from exposure during prep or recovery. And here's the kicker. Most colon cancers in older adults are slow-growing. Many won't even impact lifespan. Plus, colon cancer is strongly linked to metabolic health, not just age or family history. So what to do instead? Use less invasive screening like the FIT test or immunochemical test, or Cologuard annually. Eat a fiber-rich diet with prebiotic foods like garlic, onions, leeks, and fermented vegetables to support a healthy gut microbiome. Practice intermittent fasting, walk after meals, and reduce sugar to lower inflammation in the colon. And ask yourself, if I'm metabolically healthy, active, and symptom-free, does an invasive scope still make sense? Screen smart, not hard. Part 2. PSA testing after 70. More harm than help. Next, the PSA test, a common blood test for men to screen for prostate cancer. Seems harmless, right? It's just a blood draw. But here's what's really going on. The PSA test measures prostate-specific antigen levels in the blood. Elevated levels may indicate prostate cancer, but also infections, benign enlargement, or even recent sexual activity or bike riding. In older men over 70, prostate cancer is often slow-growing and non-lethal. Yet once a PSA test comes back high, it triggers a chain reaction. Biopsies, MRIs, radiation or surgery, side effects like erectile dysfunction and incontinence. That's overdiagnosis, treating something that may have never caused harm. According to the U.S. Preventative Task Force, routine PSA screening is not recommended after 70 unless there are symptoms or high-risk family history. So what's the smarter approach? Focus on metabolic and inflammatory markers like fasting insulin, CRP, and homocysteine. Support prostate health naturally with cruciferous vegetables like broccoli, cabbage, and arugula, pumpkin seeds, zinc-rich, anti-inflammatory foods like turmeric, green tea, and walnuts. Get movement daily, particularly walking and resistance training. And most importantly, talk to your doctor about risk versus benefit before saying yes to any prostate-related testing. Remember, not all cancers are threats. Some are turtles, not tigers. Part 3. Full body scans. The high-tech trap. Full body scans, especially CT scans, are often marketed to older adults as a way to catch something early. But this kind of just-in-case thinking comes with a serious cost. Here's the truth. CT scans use ionizing radiation, a type of energy that can damage DNA and increase your long-term cancer risk. The National Cancer Institute estimates that CT scans may contribute to 2% of all cancers in the U.S. annually. Now, if you have symptoms, chest pain, a mass, sudden changes, yes, imaging may be necessary. But if you're healthy and asymptomatic, a CT scan could reveal harmless nodules, shadows, or scars, triggering follow-up scans, exploratory procedures, stress, and sleepless nights, even unnecessary surgeries. This is the false positive spiral, and once you're in it, it's hard to get out. So what should you do instead? Only agree to imaging if your doctor explains how the results will directly change your treatment plan. Ask, is there a safer option like ultrasound or MRI without radiation? Reduce your need for scans by maintaining healthy insulin levels, walking daily, eating antioxidant-rich foods like berries, greens, and olive oil, and track your health with functional markers like HRV, sleep quality, strength test, and fasting insulin. Sometimes doing nothing is the most powerful decision. Part 4. Bone density scans. DEXA, a misleading metric. Bone scans are heavily pushed after 65, especially in women. The DEXA scan measures bone mineral density and compares it to a healthy 30-year-old. That alone is the problem. You're 75. Of course your bones look different than a 30-year-old's. That doesn't mean you're broken. And the label osteopenia, it's not a disease, it's a marketing term. Yet doctors often prescribe biphosphonates or other osteoporotic drugs based on this alone. These drugs don't build new bone, they freeze the remodeling process. Over time, this leads to brittle bones, spontaneous thigh fractures, jaw necrosis, esophageal damage. So what builds bone? Muscle, movement, hormones, nutrients. Your real bone building plan is lift weights and resistance train 2 to 3 times per week. Even light bands help. Walk daily, especially on uneven terrain. Eat collagen-rich foods like bone broth, eggs, and gelatin. Get vitamin D3 plus K2, magnesium, and healthy fats. Use sunlight, strength training, and sleep to maintain natural hormone balance. Bone density is only part of the picture. You want strong, resilient bones, not just dense ones. Part 5. Routine blood panels. The medication trap. Routine blood tests seem helpful, but after 70, they can lead you into polypharmacy, being on 5+ medications that interact in harmful ways. Here's how it happens. Mildly elevated cholesterol to statins, borderline blood sugar to metformin, slightly high BP in the clinic to antihypertensins. No symptoms, no crisis, yet 3 new drugs. This cascade increases your risk of drug interactions, confusion or cognitive decline, falls and fractures, kidney or liver stress. This isn't prevention, it's pharmacological quicksand. So how do you take control? Shift from traditional normal range labs to functional ranges that reflect metabolic health. Fasting insulin, under 8, HOMA-IR, under 1.5, triglyceride to HDL ratio, under 2:1, HSCRP, under 1.0, and homocysteine, under 10. And remember, most age-related lab shifts can be reversed through intermittent fasting, low-carb, nutrient-dense foods, strength training, sleep optimization, and stress reduction. Cortisol impacts both sugar and pressure. Always ask, is this a disease or a normal adaptation of aging?
Part 6. Functional Health Monitoring, a smarter way forward. If you avoid over-testing, how do you still protect your health? Simple, by monitoring function, not just markers. Here are smarter, safer, and more predictive tools. 1. Gait speed and grip strength. Both are predictors of longevity and resilience. Test: walk 10 feet and back. Slower than 6 seconds equals increased risk. 2. Post-meal blood sugar. Use a home glucometer. Ideal: blood sugar stays under 140 milligrams per deciliter after 1 hour. 3. HRV or heart rate variability. Higher variability equals better stress resilience. Use an Oura Ring, Garmin, or smartwatch. 4. Sleep quality.